4 babies born at public hospitals come into the world via caesarean section. This is according to the latest available figures from the 2015-2016 District Health Barometer report. And if these figures are anything to go by, almost 30 million babies will come into the world this year by C-section. This is nearly double the number of infants delivered in this way compared to 2 decades ago. But what's driving this increase? Well, consultant in obstetrics and gynecology at the Eastern Cape Department of Health, Professor Justice Hofmeyr, joins us via Skype to explain. Prof, good morning, and thanks for your time. I suppose that is the question. Why are we seeing this increasing rate of caesarean sections? Why are we seeing such numbers at a time where we find that, you know, people are becoming more conscious and more sort of mindful of the differences and the benefits of natural birth?
Well, good morning, and good morning to your viewers. This is a fairly complex issue, but I think the underlying issue is that normal birth is in fact a difficult process. It's a prolonged process. It's very painful, unpredictable, often inconvenient. And there's a tendency both among health providers and among the public to see caesarean section as actually a preferable option. It's a quick operation, it's relatively safe, and it's predictable. And so there is an underlying tendency, both for healthcare providers and for women, to prefer caesarean section. Now, the World Health Organization recommends that about 15% of births should be by caesarean section because there are some very important reasons and there are some situations where it's absolutely necessary for a woman to give birth by caesarean section. For example, if there's obstruction of the birth, or the baby's in an inconvenient position, or the placenta's lying in front of the baby, and so on. But beyond that, there are many situations in which there could be a choice between a normal birth and a caesarean section. And in that situation, there is this tendency for us to prefer caesarean section because at first, on first appearances, it appears to be a simple and effective solution. But what we know from the statistics in South Africa is that caesarean section is absolutely not as safe as normal birth for mothers, and it's also not the ideal method of birth for babies, and we can go into detail on both of those issues. But those are the key reasons why we should actually put quite a lot of effort into trying to ensure that women who are able to give birth normally have the opportunity to do so, rather than opting for caesarean sections as a simple alternative.
Well, Prof, for many years now, there's been the criticism that doctors and hospitals actually push moms to be towards caesarean sections because it makes them more money. It makes the doctors and it makes the hospitals more money. Does that play a part at all?
Well, at the moment, we're discussing the statistics in the public sector hospitals where that's not the case at all. In fact, the cost to the public sector hospitals for caesarean section is somewhat higher. That may or may not be an issue in the private sector, but certainly not an issue in the public sector. I think in the public sector, it's more an issue of a choice being made. And what I'd like to emphasize is that there are ways of trying to optimize normal birth so that providers and women are more likely to choose normal birth as a better option for giving birth. And we have done research at Coronation Hospital when I worked there in the 1980s, which showed that giving birth in a very supportive environment with a companion, being present with the woman throughout the birth, can be an extremely positive and empowering experience. And we showed that women who give birth in that supportive environment, after birth, had much less depression, had much more positive relationships with their babies, they breastfed more successfully, and they had much more confidence in themselves as mothers. So I think our emphasis should be on, and in fact, the World Health Organization has now taken this on, and the latest guidelines from World Health Organization on care in labor are actually titled Intrapartum Guidelines for a Positive Childbirth Experience. And I think if we focus on that and making sure that every woman in labor is not left alone, is not abandoned, but has a companion with her, then we can perhaps turn the trend away from increasing rates of caesarean section.
Prof, very quickly, if I can ask you, because we are out of time, but when it comes to public hospitals, and like we say, we are seeing an increasing rate in public hospitals where there's no cost to the patient there as well. So it's not a matter of them doing this because they want to make more money. Are we seeing then that maybe doctors and nurses are pushing moms towards doing the C-sections because it's quicker and they get out of there? Or are we seeing that these are the mom's choice, that they choose to do this because they feel it is quicker and it is safer for them and their babies?
It's actually both. Certainly in situations, for example, a woman who's had a previous caesarean section, there are certain risks associated with a normal birth or a repeat caesarean section. And in that situation, we would give the mother the choice. We would say to the mother, look, there are pros and cons. In fact, overall, a normal birth remains safer for the mother. The risk of the mother dying is definitely less with a normal birth, even if she's had a previous caesarean section. So we encourage her to have a normal birth, but we give her the option. And many women are choosing caesarean section. And as I said earlier, this may be because our care during normal childbirth is not as supportive as it should be. So I think it comes from both sides. And from the medical side, there is an increasing concern among doctors about lawsuits which sometimes arise as a result of complications during childbirth, which are often completely unpreventable. And they tend to opt for caesarean section as a sort of a safe policy. And this is unfortunate because we know for a fact that caesarean section is not as safe for the mother as a normal birth. And we know that there are many reasons why a normal birth is ideal for the baby's development, for the baby's breathing ability to adapt to extrauterine life, and for the baby's long-term health. We have increasing evidence that a normal birth is definitely better for the baby.
All right, thanks very much for that. That's Professor Justice Hofmeyer. He's from the Eastern Cape Department of Health, just explaining to us why we're seeing South Africa's skyrocketing C-section, that's caesarean section rates. Well, let's take it.